meniscal injuries which are more common. The pain and blood loss is minimal to nil. Surgery is always 50%, another 50% is physiotherapy. Immediately taglangane cold pack is usually helpful. 16 to late 30s are the group are most prone to sports injuries.
Welcome to the program, Dr. Pushpak.
Thank you.
So we are here today to discuss about sport injuries, which every athlete or sports enthusiast should know about. So to begin with, what are some common sport injuries that you encounter in your clinical practice?
Usually most common are knee injuries, which involves the ACL, which is called anterior cruciate. Next will be MCL, medial collateral ligament, and next will be the shoulder. Shoulder is usually supraspinatus, usually involves overhead throwing activities, and coming to the knee, there are again meniscal injuries which are more common.
So on a personal note, do you play sports or you used to play sports or something?
Yeah, I used to play sports. I used to play basketball and volleyball, but once I entered into this professional stuff, so I couldn't continue it.
So when it comes to sports injury, I'm sure there are many myths surrounding this. Is it better to use a cold pack or heat pack immediately after the injury?
Yeah, it's if it is an acute ante immediate taglangane cold pack is usually helpful than a hot pack. Hot pack eppudante chaala రోజుల నుంచి pain undi, if they want a muscle relax kind of thing, I think hot pack will help.
Another common question ఏంటంటే చాలా మంది అడుగుతూ ఉంటారు, ఏమైనా సూపర్ ఫుడ్స్ ఉన్నాయా టు కీప్ our body strong or muscle strong?
Yeah, same thing. Post surgery, patient requires a lot of protein and vitamin C, which improves the collagen and all. That should be enough. People start taking lot of meat and all. I would suggest that will only cause them bloating and all. Just take a balanced diet. That should be enough.
So sports these days are very common, చాలా మంది ఆడుతూ ఉంటారు. Even common people like us, we do play sports, some kind of sports, be it. So, but it's very common for us to have an injury because, most of us do not follow a proper routine. So, what are some preventive measures that you would advise to prevent any kind of injury?
Before playing, you have to warm up, stretches and strengthening exercises, mainly proprioceptives. Those are very important. Like jumping, how you land on the floor, that makes a lot of difference. That is why it is more common in normal people than in an athlete, because they are more trained to these proprioceptive exercises, jumping trainings, and how you throw, how you jump, everything comes into play. But for a normal individual who plays recreational things, they just jump in and they land up in these sports injuries.
So coming to the treatment part, doctor, with the recent advancements or the latest technology, I'm sure there's a lot of advancements which have happened even in this field as well.
Recent advancement is again an arthroscopic procedure. Arthroscopic procedure is a minimal invasive procedure where you could put a camera into the joint and see a magnified image of the injury inside. It's more accurate than the MRI. Arthroscopic procedure is again diagnostic and therapeutic management, where you put in a camera, see where the injury is, and you repair the ligament.
So simultaneous diagnosis
Exactly.
and treatment
Yeah.
without wasting time. Okay.
Correct.
So what are some post procedure that the patients should follow? I mean, is there any special care? Yes.
Yeah. It's a very minimal invasive procedure. It's just a 3 mm to 4 mm incision. There are 3 or 4 stabs, and patient can get back to routine maybe after 4 to 5 weeks with a proper rehabilitation protocol. But the pain and blood loss is minimal to nil.
Oh, that's wonderful. Yeah. So even the infection rate will also come down.
Yeah, since the incision is very less, the infection rate is also less.
So మీరు చెప్పినట్టుగా that the patient should follow a proper rehabilitation program.
Correct.
So what exactly do you mean by this, and what is the role of physiotherapy? Because I'm sure most of us tend to ignore that part.
See, నేను ఎప్పుడు చెప్పేది ఏంటంటే సర్జరీ ఈజ్ ఆల్వేస్ 50%. Another 50% is usually physiotherapy. A supervised physiotherapy is very important. ఎందుకంటే the way ఎట్లా చేయాలి, ఏం చేయాలి, even the patient is new to the exercises and stuff, and strengthening exercise basically. How you strengthen, ఎట్లా చేయాలి, ఏం చేయాలి, which muscle to strengthen first, and how much weight to put, how you put is very important. And how to strengthen it sequentially, and మెల్లమెల్లగా strengthening, weight పెంచడం, అవన్నీ it requires some supervised professional. But I usually prefer a supervised professional after the surgery.
Only they would be knowing it better. Because,
Exactly, yeah.
If we tend to do it by ourselves, we tend to injure it more
Yes.
further.
చాలా మంది పేషెంట్స్ సార్ మేము యూట్యూబ్లో చూసి విల్ డూ ఇట్ అంటారు, బట్ స్టిల్ సీయింగ్ అండ్ లెర్నింగ్ ఇస్ డిఫికల్ట్ దాన్ బీయింగ్ సూపర్వైజ్డ్ బై సమ్వన్.
Yeah. So చాలా మంది స్పోర్ట్స్ ఇంజరీతో మీ దగ్గరకు వస్తారు కదా డాక్టర్, బట్ సమ్ ఆఫ్ దెమ్ కెన్ ఆల్సో బీ ప్రొఫెషనల్ athletes. So how do you deal with them? Because for them it's like related to career and for their entire life.
See, these procedures can get back to their near normal life. So that వాళ్ళకి usually they doesn't have to think much. The only thing they need to give time and rehabilitation protocol. Once they strengthen and increase their proprioceptive stuff, they can get back to their sports maybe in 6 months. And it's a minimal thing, and even in ACL, we reconstruct the new ligament. So it is almost like your original ligament. So they can get back to their
sports as soon as possible. I think that's wonderful. So I'm sure that you must have treated so many patients, especially with sports injury. So is there any success story or any patient story which is very close to your heart?
Yeah, there was this young patient who's a gym enthusiast. He was lifting weights, and he had this supraspinatus tear in his shoulder, and he wanted to not spoil his body with a scar, and he was very much particular. But yeah, he underwent this arthroscopic supraspinatus repair, and he was back on his feet maybe in like 5 months. He was lifting weights, and another person who was a football player, he had this meniscal injury with ACL. So we have done an ACL reconstruction with the meniscal repair, and he was back on his feet by end of 3 months. He started training in gym, proprioceptives, everything, and happy to know that he's back in football now.
So thank you, Dr. Pushpak. It was wonderful interacting with you on our health talk today. And so before we wrap this episode, is there any message that you would like to share with our audience out there?
I would say you need to strengthen your muscles. Warm up and stretches are important. Don't just jump in and play sports. Please warm up and do stretches.
So this brings us to the end of this episode. Hope this episode was informative on the topic sports injury, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.